in the chat where you're from and where you ran this weekend. We'd love to hear it. Go ahead, Abe.
Okay, so as people are saying hi in the chat, I'm going to go ahead and just start off with introductions. My name is Abram. I am the sort of owner principal at Aspire Adventure Running. We're coming up on our 7th season of supported backcountry runs and trips. Really kind of focusing on endurance athletes, getting to those hard to access but super beautiful wilderness and backcountry spaces. Kind of we see ourselves as experts in logistics and support for runners who want to do big days in the mountains. So Kate, you want to intro yourself?
Yeah, sure. Hey, everybody. Thanks for joining us tonight. My name is Cate Airoldi, and I'm a newbie to Aspire, but I'm super stoked to be here with y'all. And I'm the one that's responsible for the training plan that a lot of you have probably jumped onto. And I'm currently doing some graduate work in exercise physiology, sport performance coaching, and then it's morphing into a doctorate at this point in bioenergetics and physiology. So that's kind of my background, lifelong runner. Just recently moved back from Norway. So I spent some time abroad training and doing some work and study with some of the super awesome athletes over on the other side of the pond. And that's me.
Great. We're super excited to have you. So Kate will definitely be available here after our discussion with Andrew to kind of take any questions people are having about the training program and how things are going. Trent, you want to welcome yourself?
Yeah, I can welcome myself. Hi, everyone, and welcome to the webinar. I'm Trent Banks. I am a senior guide with Aspire and help Abe out with a lot of marketing and hashing out dreamy ideas. So excited to hear what Andrew has to put to us and also get a little wisdom from Kate today. Thanks for showing up. I will say, if you have questions over the course of the day, you'll see down at the bottom, on the bottom kind of tab bar, there's a couple options. There's a chat, which many of you have found, and then over on the right side, there's a Q&A. If you open up that Q&A, you'll be able to actually enter a question, type it, and so that'll help us to kind of get to your question and select the ones that we'll be able to work with during the course of the webinar. And if we can't get to your question, sorry, we'll try to answer it. Sometimes we can answer it off screen and actually type an answer. So thanks for being here, guys.
Andrew, you're up.
Hey, I'm really excited to be here. My name is Andrew Fast. I'm from Woodinville, Washington. I live in Salt Lake City now. I'm in the Front Range of the Wasatch. I am a doctor of physical therapy and met Abram and the Aspire crew out on the Wonderland Trail some time ago. And I'm just such a believer in what they're up to. And so I'm really excited to be here. Really beyond words. Like I just think this is such a good community, a really good group. A lot of my day-to-day is working physio with mountain vertical oriented folks, people in their 70s who are also pretty keen to get out and enjoy nature and the wilderness. So I would say holistically, I like helping people, and that's really why I'm here. So I would say just for anybody that's tuning in now, don't compare your first draft to somebody's final draft. There's going to be probably a pretty big mixed bag of experience levels here. And my goal and hope is that I can provide a pretty general approach to some concepts that apply to everybody. And so don't be afraid to ask questions. I mean, that's from what I gather, that's why we're here. I'm stoked to be here. I'm at the ready to answer questions. And yeah, that's it.
All right. Cool. Looks like Kara joined us as a panelist. Kara's one of our staff members. I don't know if she got like a behind the scenes. Did you want to be a panelist, Kara, or did you just want to watch in?
I don't know if people can see me. There we go. I think it's because I use Trent's link. So I'll just mute myself and listen in with everything. So, but I use TransLink. So hi everyone. I'm also a guide with Aspire, but excited to be here and learn from you guys. So
cool. All right. Well, we're glad to have you. I didn't realize you were coming as a panelist. So okay.
No, me neither. Me neither. So I'll mute myself, but
Okay.
happy to be here.
Well, good to see you. So I would say, like, what we want to do for our flow this evening, folks, is we're gonna give some time to Andrew. Injuries and how to avoid them is a topic that like affects all of us, particularly as we're in the training phase. Well, kind of at all points in our season, right? Like, you know, and I think right now is the time where, as we are ramping up our miles, depending on what your base has been like, depending on how much stretching and strength training you've been doing, even if you've been like doing it like quote unquote perfectly, like stuff comes up. And so really excited to have Andrew and give him some time to sort of like from his perspective, working with lots of athletes that have a similar mindset as us. We're training and preparing for our summers. Like, what are some of these things that come up? How can we avoid them? And so we'll start there. After we hear from Andrew, and there'll be definitely time for questions, we'll give some time, definitely, and I'm guessing Kate will kind of pepper in and she'll have some insights. We'll kind of weave them all together. But we do want to give some time for folks who are doing the training plan to be able to ask questions like, hey, you know, here's what I'm seeing specifically around my training, around my mileage. Kate is the designer of the program. And so, you know, we want to be able to give folks a chance to kind of ask any questions they have. And then as we wrap that, we'll do we're kind of using these webinars to do a deep dive on each of our stage trips. And so we'll spend a little bit of time just talking about our Yosemite trip. And if people want to stick around for that, then that's great. So without any further ado, that's our flow. And Andrew, what are these injuries that we can expect to, you know, see unless we do the things you tell us we're going to do?
Yeah, really good question. This is kind of, it was a running joke. We went on a spirited bike ride today with a group of folks, and I was like, I don't know if I should prepare a PowerPoint or not. And it started off like at mile 1 of the bike ride as kind of a joke, but I actually prepared a short PowerPoint presentation. So awesome. I don't have a laser pointer. I am not very appropriate. I mean, I have a backwards ball cap on, but I did prepare a PowerPoint because I want to talk about some concepts that I think what I want to do here is go kind of broad spectrum down to narrow spectrum, and most of the things that I see come into the clinic, they really boil down to a really simple equation that I kind of wanted to unpack via my PowerPoint. So I'm going to see if I'm smart enough to share my screen, and we'll dive into that. That being said, I can still, I think, see and hear you, Abram. So as we go, it's totally meant to be conversational, but let's see. Oh, no, it's disabled.
Let me undisable it.
Okay.
Well, you know, here's what I'm going to do. I'm going to make you the host, and that should give you control to do that.
Okay. Oh, here we go.
All right.
Take hold now. Desktop.
You're driving, man. Take us wherever we're gonna go.
This is exciting. See if I can that. Okay, guys. So give me a little bit of feedback. Can you see what I'm seeing as far as my name and email address?
Yeah, it looks good.
Okay, that part's not really relevant necessarily, but I put that up there so that people know that I love what I do. And I'm available to you. So if you get done with this and you're out on a run tomorrow and you're like, dang, I should have asked that question. Again, like, I'm here to help. So that is all my contact information. Just please don't call me in the middle of the night. But there it is. Well, let's see if I can go to the next slide. Maybe.
I think if you click that, yeah, that one right there.
So it was at the end. Okay, let's try this.
Boom.
Okay, we already did a little bit of introduction and about me. Again, I'm a doctor of physical therapy and an athlete myself, and coach and guide some athletes. My intent for tonight is that we don't compare our first draft to somebody's final draft, meaning this is very much, I think, about the Q&A. And so I've tried to do some case studies and offer a little bit of what I've seen out there in my clinic and with guiding athletes and from my own experience anecdotally, but then also offer an evidence-based approach. So the schedule for what I want to talk about briefly here is just outline the equation that I base my own training and athletes that I'm working with around, and that's the growth equation, which we'll talk about. I have a couple case studies that kind of circle back to this kind of growth equation. And then I want to define some key principles of overload that applies biomechanically, like why do we have pathology knee down? But it also is readily applicable with the same principles to your training plan or your training cycle. And then talk a little bit about strengthening and where I like to focus initially and then stem out from there, which is a proximal to distal approach. This equation, and let me know, is my volume and can you guys see what I'm seeing still okay?
I'd say yes on mine.
Yeah, looks good.
Yeah.
Roger Dodger. So here's how it breaks down in my mind. I think a lot of performance, and I use that word delicately, it's very, very simple in my mind. And I think it's very easy to make things overly complex, but I don't think they need to be. When I see pathology or when I look at a training cycle, I think basically it boils down to the equation that's in front of us, which is basically we have stress, and then we have rest or absorption, and then you have growth or performance or fitness or any word that we would want to insert there with upward trajectory. So that's where I base everything off of, whether it's a pathology or whether it's somebody working up towards a 100-miler. I think a lot of it boils down to this equation, which is very different and unique to each individual. But the starting point has to begin here, and it's very simple in my mind. So that's the broad spectrum approach, and then we're going to kind of narrow in. But I think it helps to just define what I'm meaning here, because it's not just physical, right? So we could have a hard training session, or we could get fired from work, or your child gets sick. You have too many hard days in a row and the density's too much, or your cat gets stuck in a tree and you've got a tempo run to do. And my mantra is always TSS is TSS. Whether or not you're familiar with what TSS is, it's the total stress score, training stress score, but it's basically how much fatigue or work have we done within this amount of time. What training peaks and these other very fancy watches and what have you don't account for is your cat getting stuck in the tree or getting laid off at work. And so I think it's important as a starting point to just acknowledge, for anybody out there listening right now, even to list the stressors in your life. And stress isn't a bad thing, but it is work. And so I think it's important to start from a standpoint of where are we beginning as far as load, because that's a word that I'll use later on. And I think it's ultimately something that has to be balanced with rest. And so when we talk about rest, we are talking about biomechanical things and physiological concepts like sleep, nutrition, time with your loved ones, meditation, time in nature, body work. But really, in my mind, stress is absorbing the work. So we have work, which is the training, which is relationship maintenance, which is all this other thing, the stuff that we do day to day. And then we have to have some sort of yin yang balance with absorbing that workload. And when that gets out of whack, and it's very situational and dependent upon the person, the answer to why we have pathology or injury or overtraining or burnout is because this equation isn't working. And so I think that's the starting point, is we're not absorbing the work, because that's really when the growth happens. I would also say that when we're talking about growth, and I think all of us probably hopefully tuning in, we want to be our best selves. We want to perform well. But that might just mean running the Wonderland and having a positive experience and not being injured, or it might mean finishing every day and wanting more. But I think a qualitative approach is so important, right? So I'm working with a 10K runner right now who their goal time is written on their mirror, it's written on their wrist, it's written on notepads, and every time they see it and they don't meet it, a negative cycle develops. Whereas a qualitative approach, meaning I want to feel strong, I want to feel resilient, I want to feel durable, I want to feel compassion towards myself. I don't care if you're an Olympian or not, or just starting out in running. I think a qualitative approach doesn't exist enough in endurance sport. So that's my one chirp for a qualitative approach, because I want to do these sports forever. I think a lot of people also do. So we need to take this a little bit of a qualitative approach over splits and weekly mileage and yada yada. I think it's often helpful, at least for me, for those out there listening. Everyone's coming from a really diverse background, and so I've listed a couple case studies here of creative fictitious characters who kind of hopefully encompass a group of people within that, but maybe you can adapt it to yourself, just to highlight this equation of stress plus rest equals growth. And this is just to kind of highlight when things are out of whack. And ultimately, we're here to talk about, well, why am I injured, or why am I underperforming, or why am I not, getting towards my goals? And this is mainly anecdotal, just what I've seen with athletes. But I would say for folks who have been in sport for a long time, and they will come into me and they're asking these questions. Victor comes in and he was doing triathlon before triathlon even existed. Like, he invented the aero bars. He made his own waffle shoes before Nike existed. And now he's in his 60s, perhaps 70s, and he's not making any gains. And he's wondering why he's not progressing. I think in that case, we kind of have to look again back to that equation of perhaps there's not enough stress in the equation, given a whole slew of variables. But kind of zooming out on, well, why have we plateaued? For example, with somebody who's may have been in sport for a long time, there might not be the right type of stimulus. The second two people that come to mind, and I've worked with a lot, is Gary the Greenhorn and Nancy the Novice. These two folks are highly motivated. They want to do all the work. They live, eat, breathe, and sleep endurance sport. They got the posters, the watches, all of the gadgets. But at the end of the day, like, it's just so much work, and life is out of balance. They're not talking to their family anymore. They're just living to be this athlete. So the sustainability is the operative word, and that isn't really happening with these folks. And so in that situation, there's too much stress going on. And so there's not going to be any growth because there's no absorption. So there's no rest or recovery or absorbing all of that workload that's being done. And so there's a bit of functional overreaching. And I think we have to be mindful that regardless of our levels, we have to constantly be evaluating, are we overreaching or are we underreaching? And I use the word functional overreaching to say overtrained, irritable, not as hungry as you normally are, sleep quality goes down. I think functional overreaching is hard to put a metric on, but it's something that when we're talking about injury, we're talking about burnout, or we're talking about underperformance, functional overreaching really just boils down to this qualitative approach to goals. Like, what are we trying to get done here? And so if you don't feel strong and if you don't feel resilient, it's a pretty easy fix. But if you lose sight of that through metrics and too much detail focus, which I think people early in sport, endurance sport, enthusiastically fall victim to, then we get in trouble. The last one is I think it kind of ties it all together in my mind. This is actually a training partner of mine who, on our drive up to Lake Placid, revealed to me that she was going, and this is we were living in a small town, revealed to me that she was going through a divorce that nobody knew about, and then went on 48 hours later to win Ironman Placid, and then 2 weeks later go first place all the way through mile 23 of the run, and then have the last 3 miles. She ended up second place within a 2-week span of an Ironman, got first female pro, and then went to Kona, did 3 Ironman in a year. And then the next year, when we're talking about physiological adaptation, that's a lot of stress. And so what you see in the years following are a bit of adrenal fatigue, a bit of burnout, a bit of a reinventing of the self, because there's so much stress. But it's very hard to kind of sit back and see that when you're in the heat of it. So it's just a plea to stay in tune with that very fundamental equation. The key point that I'm trying to make here from this kind of broad spectrum, when we're talking about injury as it relates to why does it happen and how does it happen and how can we reduce the risk of injury, is that a qualitative approach matters. I mean, and that's going to take some self-reflection and some analysis of the load that you're putting on your system, and then also what you've peppered in as far as absorption and rest into that model. And the second word there, reactive, in my mind, means that I've read a lot of really, really pretty books with graphs and charts and a plan that's maybe 3 months long or 12 months long. The hard part there is that it's not reactive. So it can't account for the cat getting stuck in the tree or getting laid off or getting the cold or, heaven forbid, getting COVID. And so we have to allow ourselves, when we're talking about injury risk reduction, there has to be some reactive nature to your training cycles. And that's hard because most people that are tuned in are triers, they're doers, they're pushers. Like, we're here because we're motivated. And so the hardest part is being reactive to again, what you're feeling and what's going on around you. But ultimately that's going to lead to absorbing all that workload. So I think that's the hardest part. But I think if you're really truly going to absorb the workload you're putting on your system, you have to be reactive to a multitude of factors that are very holistic as far as looking at all the stressors in your life. And then fun. I think this kind of goes back to the greenhorn and the novice. The organism having the most fun absorbs the most fitness. I genuinely believe that. So training should not be like work. And once it gets to feeling like work, I think that's when we kind of tune out and we're just hammering. And that's also what I've seen. That's where faulty movement patterns develop, and we're too headstrong to notice, and our foot starts to hurt and turns into a stress fracture. And before you know it, you're in a boot for 12 weeks. So you got to make sure that you're having fun for what it's worth. My plea for fun. I'm going to shift gears a little bit and show you how are we doing as far as seeing my screen. You guys still good there?
Yep.
All it's
Awesome.
good.
I just want to, this is a mentor of mine, Chris Powers, has a movement performance institute. He's a head of physical therapy at USC. And he's done a lot of really good studies on below the knee pathology. And when we're talking about below the knee injury, it's important to really hone in on, well, what is it that we're talking about and where is most common, so that I can hopefully speak to the most people that are tuned in. Knee injury is 42, that makes up 42% of the cases that come into physio. Foot and ankle make up about 17, and then we've got lower legs, so maybe stress reactions or stress fractures, and that's the lower leg. And then you can see as that list goes on over here, that'll kind of get into other pathology. But what we see is a huge percentage of pathology at the knee. As far as runners and overuse, patellofemoral pain syndrome, so just basically anterior knee pain, and IT band friction syndrome make up a pretty large percentage of the pathology that I see in the clinic and also in the literature. I mentioned that because I want to shift gears and talk about a couple key concepts that ultimately lead to below the knee injury. So what I understand my role to be today is to talk about, well, what are common injuries and how do we prevent them from happening? And in order to do that, we have to have a platform of understanding of concepts that lead to pathology below the knee. And ultimately, we're talking about stress and strain. And so looking here, Chris has done a nice job of very simply defining this notion of deformation that occurs as a result of loading would be strain. So you've got an over lengthening moment. Now, if everyone were, and you don't have to stand up right now, but if you were to stand up and drop your knee towards valgus, like this patient over here on the left of the screen, you can see that on the inside of her knee, if there was an MCL there, well, there is, it's going to be at this elongation moment. It's going to be stretched because that knee is being pushed inward, and the IT band is also going to be put on tension. IT band runs from up here at the proximal hip down just distal to the knee joint here. That's going to be put on tension as well. So we just basically have this levers and pulley system of strain. And when we have forced elongation of tissue, over time, we're going to have breakdown and we're going to have pain. Same thing happens with the Achilles tendon, right? So if we have landing pretty upright here, knee is relatively under hips versus this angle here, we have strain on that Achilles tendon. And so over time, you're going to have pathology. It's going to be an itis, inflammation, and then it's going to turn into tendinopathy over time. So you basically have this concept of forced elongation. And then the second concept, and we'll shift back, is force. when we're talking about knee pain, which again, 42%, joint stress, like ground reaction forces, we need to disperse that area. So you've got force and then you've got area. If we don't have good mechanics and we are landing a certain way with, similar to up here, strain on the MCL, strain on the IT band, and a lot of point pressure on a certain area of the joint surface and the knee, that force is not dispersed over enough area. And so what happens? Well, we get approximation of articular cartilage and it hurts. It's pretty simple. So
Andrew, if you're sorry to interrupt, man. If you're able to maximize that window, I think it might help some folks in the audience to see a little bit better.
Yeah, sorry. Let's zoom. Let's make it real big.
Nice. Yeah.
How's that?
Yeah.
Is that better?
I don't know if you can see this there's a little pop-up says you're sharing your screen, but that's also on the screen. It's currently covering a slide or two. Perfect. Thanks.
Yeah, no, thanks for the feedback. I'm flying blind here a little bit. Is that better for folks to see as far as the images here go?
Yes.
This is the main one that I kind of want to we're going to stem quite a bit from as far as our concepts go. Hip symmetry on this side, there's no contralateral hip drop. The knees plumb. We drop a plumb line from the ASIS down to the patella, down to the medial joint line on the ankle. Whereas on this side might be a little bit of contralateral hip drop, but then that goes down to the knee, and we're going to get pain at the knee because, again, these concepts of strain and force really don't go in line or in sync with that same stress plus rest or absorption concept that we talked about earlier. There's just too much stress or force and strain in this case in order to absorb ground reaction forces that are going up the kinetic chain. So that's the main thing that I wanted to talk about there as far as these key concepts. I'm going to see if I can go back to this guy. So I want to talk about strengthening briefly, and then we'll get done with this PowerPoint. The main concept that I want to use as a launch pad to answer questions and talk a little bit about why injury occurs is the hip basically being the bully on the playground that pushes the knee around. So whether it's an ankle injury or whether it's a knee injury or even a hip impingement or a labral issue, typically there is a lot of strong literature to suggest that pathology begins from bad mechanics at the hip. So it's a proximal, meaning up at the hip, to distal, meaning down at your big toe approach as far as strengthening and movement correction goes. The way I think about it as a cyclist and a multi-sport athlete is your body is beautifully designed, and it really is. It's this beautiful, perfectly designed system of levers and pulleys, similar to a bicycle wheel. We have all those spokes in a bicycle wheel, right? And when all those are tensioned just right, that wheel spins perfectly true, and it's designed to cover a really long distance without any issue. But what happens when one of those spokes gets a little bit weak, right? We get some brake rub, or it just is unpleasing to look down at if it's your front tire. But we also have inefficiencies, and that's going to lead to injury risk. So if the hip is not doing its job from a movement and coordination and strength perspective, the likelihood of knee pathology and knee down injury goes up dramatically. And so the as far as a load progression and a strengthening perspective, that's the approach that I tend to take, and wanted to a little bit more with you guys as far as strengthening goes. The last bit on the why does it occur? It typically, there is something that we could optimize from a strengthening and movement coordination standpoint at the hip. What could we do from a actual intervention, or what could you do now? There is a plethora of strengthening exercises that you can do for glute med and glute max strengthening that are easy, quick search on YouTube, but I'm also happy to send those out to you if you have specific questions. But I think the ultimate answer is it's gluteus medius has been shown to be the most powerful player in proximal hip strength and coordination. And so that's where I would start my injury risk reduction program for almost any runner that I'm working with. If they're coming into me with whether it's Achilles pathology, stress reaction in the shin, or knee pain, we tend to start with gluteus medius, gluteus maximus strengthening isometrically, and then from a force recruitment standpoint, adding load over time. So that's the that's the platform.
Just that.
That's all you need. All you need. Of course, a PT is going to say all you have to do is clamshells, but it's so.
I would definitely want to. Definitely don't feel like you have to like. I mean, I think silver bullet answers are like, you know, they're problematic in general. You know, when we're talking with lots of different pieces, but I think, you know, what we asked you to do is like, what do you see most common? You know, and like we're a general audience, right? You're not working with any one of us one-on-one. And so as we're absorbing and learning and moving through our training cycle, like, okay, you know, what are those cues that I need to be, you know, tuning into? So I think, you know, you've nailed it with the hip and the glute med and for sure. So
I was hoping you just disagree. I was hoping you just disagree with me and ask me a really hard question I didn't know the answer to.
Well, I can ask some harder questions. You know, so well, let me throw a couple questions at you. Then maybe there's folks in the audience for sure that will have some questions, and they can put those in the Q&A, and Trent can kind of pull those up for us. So I guess, you know, for someone, you know, who's doing this work, like at what point how do they even know they're having a problem, right? You know, because, you know, like without pain, right? So like, okay, I'm starting to have pain and injury, and that's a pretty clear indicator that I have a problem. But for someone who, you know, isn't having pain, they're in the early stages, maybe their biomechanics aren't just right. Like, how do I identify that so I can take a preventative measures? Like, should I go see someone? Should I take some video? Like, how do I really know that I have a problem?
Yeah, it's a really good question. I always like one of my like quick go-to mantras, because I feel this as an athlete and I see it as well in my patient population, is you have to train a lot in order to train a lot. And so what I mean by that is, let's say that this athlete that you're describing is been in sport for a pretty long time. They're going to have a pretty intuitive sense of like, wow, I'm not feeling as good as I do on my normal run or something. And so they've put in the work and the sweat equity to have this intuitive sense that comes from experience to say, okay, I'm underperforming. I'm not as hungry as I normally am. I'm a little irritable. All those overtraining type, underperforming type, niggle type warning signs. Mm-hmm. I think where it's so I think that's an easier one. And that's just responsibility of the athlete who, again, you have to train a lot in order to train a lot. That person who like has the experience, they just have to be honest with themselves, because if you're a pusher and a doer and a trier, you like the work. It's less exciting to pull back. It's less exciting to rein in on the absorption part of that equation. But the crisis side of that is that now you're underperforming on race day, or for a Yosemite run, or for day 2 of the Wonderland because you came in overworked, right? But like, nobody has ever told me like I'm too fresh or I'm too strong. Like, nobody's ever said that, right? So like, you're like, find me anybody who's able to come in and into my clinic, or an athlete that I'm working with who's like, oh yeah, I don't know, I'm just too fresh. Like, nobody says that. And like, none of my, like, all my runners are, I'm like, look, you need to pick up some heavy things and put some heavy things down so you're durable, because you have to get strong in order to, you know, like, get strong to run, don't run to get strong, right? And so I think a big part of this is a little bit of doing the part that we don't love as much, which is really pulling back, and having the ability to, even if there's any sense of whether you're new to the sport or whether you're a veteran, you've got to have a little composure and patience. And that's really hard for highly motivated athletes. But I don't think it warrants necessarily going and seeing a healthcare provider straight away. because again, I think freshening up a bit and shedding a little bit of fatigue. I mean, there's this notion of like a few weeks forward and 1 week back. But I think that reactive component that I was talking about earlier, I think people would do well to be able to have the self-awareness just to react to their what they're feeling, which could just be go light for a couple of days.
Yeah. And I think that's good I think that's really good feedback. I guess my question, and I'm glad you answered it that way, I want to kind of take it a little bit of a direction, which is like from a biomechanical sense, right? Like, how do I know if my biomechanics are off, I think training a lot, you would get that feedback. But if I'm new, we get a lot of people who, for what my sense of our audience from our poll last time we did this is like, people have kind of dabbled in training. Maybe not as many people have worked with the coaches, and like they're motivated, but maybe they haven't had that really clear feedback in terms of like a gait analysis or really can understand their biomechanics. So if how would I go about trying to identify a biomechanical error in my running form? Yeah,
in a really simplistic sense, I think anything over a 4 out of 10 pain. I use the pain rating scale often. So 10 out of 10 pain is like, I need to get to the emergency room. 0 out of 10 pain is nothing at all. I think oftentimes just like if it's a niggle or something that's creeping up and it's interfering with your experience and having fun, I usually drop the hammer at 4. Like if you're getting more than 4 out of 10 pain during or after sport, you have to go do something about it. Like it's not just going to go away with rest alone. And often it doesn't. So I think using an objective pain rating scale is a really good starting point. If you're thinking you might have something creeping up on you, I would start journaling in your training log or just on a piece of paper, a date and a number. And then you can plot, then you have some data that you can objectively plot a line and say, wow, I've had 4 out of 10 heel cord pain for 2 months. Like that sucks. Go see somebody. Whereas if it's like a 1 or 2, well, training volume's up and maybe it's okay to run through. The other thing I would say is like, it's the risk. In my mind, it's always from like EMT days, it's either a load and go or it's a wait and see. So and what I mean by that is, what is the risk of going to see a movement specialist like a physio? What's the risk of going in if you think you might have an inefficiency, or you think you might be galloping in your run, or you think you might be not running well? What's the risk of one visit of going in with somebody who can evaluate how you're moving and give you some intel that could help you run longer, run happier? Like the risk is very, very low unless your copay is crazy. So I guess my short answer is like 4 out of 10 pain is where you gotta have to be honest with yourself. But then also, what's the risk of doing it even if you don't have pathology? Yeah.
That's really good.
I just dropped in the chat a link to Kate's first blog post for this training series. It's called "What is Gait and Why Should Runners Care About Theirs?" And there's actually some really some great information in there that Kate wrote about, and how to kind of look and evaluate your stride, and if you've got supination or pronation, and then along with that, and maybe this is a great time to kind of move into some of those strengthening exercises. Kate did a series of videos for that blog that are I think mostly focused on strengthening the glutes. So I linked to the playlist for all of those on YouTube. Andrew's stoked. And I don't know if Kate, do you want to say anything about that blog?
Yeah, sure. Well, thanks, Andrew. That was an awesome PowerPoint, and I'm just kind of stoked that it's kind of jiving with the blog series that we're doing. And for people to, if you've read any of the blogs that we've put up thus far, or if you tuned into the first webinar, you'll notice that there's a real consistent theme here that Andrew's been talking about with durability, building durability, kind of always erring on the side of, really approaching your training with that qualitative lens, rather than getting really myopic with the metrics of precisely what you're doing or what you're logging mileage wise or vert wise on each run. And a lot of that feeds into pathology that builds over time and can kind of be insidious or intractable for people. And I'm sure that's kind of what you see clinically, Andrew, is that, this is something that, I would hazard a guess, just like Andrew said, that a lot of us we tend toward overdoing and overperforming, and being that person that's out there longest, most, doing the hardest thing that we can possibly find for ourselves, whether that's out on the trail or piling on home stress, work stress, training stress. Something's got to give eventually, and that's where you'll see pathology show up with a lot of folks. But again, I think, just from my own personal experience with being an athlete, lifelong athlete as well, it's having that honest conversation with yourself about, okay, how would I really rate this pain? And would I ask somebody that I love or care about to go through the same amount of pain or discomfort that I'm feeling, and then kind of turn that lens back on yourself and treat yourself with that same sort of compassion? Because I think, that's where you might get a real honest answer, and keep track of it. I mean, I am not a person that loves to journal, and that falls into the category of things that I've got to do to keep myself going. But I do keep a training journal and a pain log if I'm having consistent pain. And so that blog post that Trent's talking about, that's the first one that's up on the Aspire website, but you can take a look at that. And again, this is a broad brush. We're working with a really awesome, diverse population of Aspire fans. So, with advice that you might read on the internet, or whether it's a blog post, just take it with a grain of salt. Know that we're all individual beings with individual, we've all got our individual quirks, and genetically we're all different, right? So what applies to you doesn't apply to the next person, and what applies to you one day may not apply to the next day in training. So think of it with kind of a broader brush. And again, I think that I'm super stoked to have Andrew here, because a lot of this is sort of jiving with kind of with what we've been talking with you guys about, and what's in the training plan as far as kind of treating yourself with compassion and making sure you've got an aspect of fun and enjoyment. Otherwise, why are we here, right? And I think a really good old adage, I guess, of a training philosophy is that training breaks you down and recovery is what makes you stronger ultimately in the end. So that's kind of like that equation, and that's kind of what I try to live by with my own training as well, and what we're hopefully instilling for you guys as well.
Yeah, it's actually probably a good time to kind of, there's a couple of the questions here that came in for Andrew, but like to put it out there, like this is probably a good segue where if people, if people have things that are coming up for them in their training, we've been into it now for 4 weeks. You've got some experts on the line, both Cate and Andrew here are available to sort of like cue in, like what if people want to chime in the chat or questions they have for the things that are coming up, questions around their training, we'd be happy to respond to those.
Yeah, we've got a couple here. So I'll put this to you guys. This one's from Marla Haishima. And her question is, what if the hips are the part that hurt? So that came in back while we were, while you had the PDF up with the iliotibial and those images.
It's I mean, I think to run with the analogy of the bicycle wheel, it's hard to fix a bicycle over the phone. And so without knowing exactly the pathology that we're talking about, it's hard to say what is causing necessarily the hip pain. It's actually impossible for me to say. That being said, if we were to assume, and I don't want to be perceived as saying that everything relates just back to weakness. That's not necessarily what I'm saying. But there is very in more recent studies, the literature is really strong as far as progressive loading. And I use progressive loading as the operative word to say that my first question is, well, why is the hip hurting? So is it a loading issue? Are we loading the hip improperly from a coordination standpoint? Or are we loading the hip improperly just because of too much mileage too soon? I mean, there's a lot of factors that might go into an improper loading of the hip. And so it's specifically, if the hip is hurting, it doesn't necessarily mean that all we have to do is strengthen our glute med or our glute max. That being said, I think load in my mind becomes a very important thing to be looking at. How is the hip being loaded? How is the total strain, the strain of training going through, as far as going through the hip? If we have faulty movement or a weakness in the hip or even a tightness, tight muscle is a weak muscle. And so there could be a lead to pathology just due to a weakness in the hip, or perhaps our training is a little bit out of whack as far as how we're loading our system that's not moving well. So I think that's a really, really good question, but I think it also, I do really genuinely want to help you. And to that end, I would say if you were to get in with a physio who understands movement well, that would be a very good starting point to figure out the why, because it's always about the why. Why is the hip hurting is our starting point. So I definitely recommend, perhaps if it's something that's, again, that qualitative approach, would you treat a loved one this way, type of pain on your body? And if it's over a 4 out of 10, let's get in with somebody. Let's have them take a look, because the risk of doing that's very, very low.
And the reward and gain and what you're going to learn is really high. I mean, I think so much of, as we think about training plans and you talk about, you train a lot to train a lot. And I think there's a physiological piece and there's also just an educational side to that is, this webinar, this conversation is one part of a continuation of learning and growth. And so for those of us who are, it's just a continuation, right? So there's a lot to learn in those one-on-one visits. The ones that I've had, I've really gained a lot, because it's like, oh, now I've got this isolated time one-on-one with a professional who can really zero in on where my needs are at. So that's
absolutely. I would say too,
there.
My wife works in ortho as well as a non-operative doc, and we'll have patients who have had a bad track record of providers. And so I would say, if your hip is hurting and you go to someone who you don't necessarily, they don't understand runners, or they don't really understand this this idea that, like, I'm going to run no matter what you tell me, so help me get back to running as fast as I can. Don't be afraid to get more than one perspective in the room. I always like to tell that to people as well. Absolutely go. And if you don't jive with the provider, that's a-okay, but I would go see another one. Don't give up is my plea.
Got a couple of folks wondering about some good exercises to strengthen the ankles. You guys have suggestions or resources?
Yeah, well, one thing that Andrew mentioned that is kind of really intriguing as an athlete, myself, and then also just from a professional perspective, is this idea of progressive loading, right? So that's something that can be applied throughout the body. So the hips certainly, just like Andrew was saying, are the basis for a lot of pathology. But if you have honed in on a particular joint that needs some sort of progressive loading, that's again where you might seek out a provider that can take a look at your whole kinetic chain and look at where is this dysfunction starting and where is it descending to or ascending to? Is the symptomatic portion, truly the generator of your pain? Because Andrew, I'm sure you've seen clinically, that's often not the case, Yeah, that's just kind of the end piece,
Yeah.
It's the end piece of a lot of dysfunction that's occurring somewhere else in the body and just landing at the weakest link, or maybe even not the weakest link.
Yeah.
But for ankle strengthening, I personally, people will be familiar with TheraBands. There's a lot of, if you guys really want to nerd out on this, I'm sure Andrew would have a lot more to say than I would, but Jill Cook is somebody that's done a lot of research on tendinopathies, in particular Achilles tendinopathies, which you may want to just do a Google Scholar search. And even if you don't understand the entirety of some of her academic writings, she makes a really strong case for isometric strengthening of the Achilles. And an isometric strengthening activity is essentially, where you're not concentrically contracting or shortening that muscle, and you're also not lengthening it. It's just staying pretty much it's staying the same length. So it's like a hold is what that would look like. But Andrew, I'd be curious to see what you have to say on this as well. But just banded exercises at the ankle, and also working on ankle mobility, dorsiflexion in particular, tends to be limited with a lot of us runners. So looking at mobility, but it's that constant balance between mobility and durability. But as far as specific exercises, I'm sure Andrew can jump in with some great ideas here.
I think I wish we disagreed, but I think so far I like it's entertainment value is a little bit low, because I think you're brilliant and awesome, and I agree with 100% of everything you just said. The only thing I would add is we have to ask ourselves why. I mean, why is the ankle hurting? And I think you touched on it, but maybe that's where it manifests. But we don't. I think from a provider standpoint, I try not to treat the symptoms. So yes, the ankle hurts, but why is the ankle hurting? That's not what the person asks the question for. So I will say that, but then I'll also say I think there's a lot to be gained for hip hinging exercises. So from a stability standpoint, I think doing a simple movement pattern like a single leg deadlift, or a walking lunge with a twist, side steps with a band around the toes, both feet, I think is a good one. If you're a chronic invert sprain person, doing side steps with a band around like your pinky toes, looped band, and then doing that flat footed at a little bit heel off the ground and then heel all the way off the ground. That tends to be when we aren't paying attention. And then do it with your eyes closed. So I think that environment always has to be varied, like mixed and varied practice. So we're never doing the same order of exercises, and we're never doing it in the exact same rep dose, right? Qualitative approach. So we're going for fatigue and we're going for challenge, and then we're done. So a little bit, I'm a fan of, as far as strength training and load progression goes, quick and dirty, minimum dose for maximum effect. So get the job done and then move on. So I think those would be some good ones to start with. Add some hip hinging component, and then if we're assuming, just as an example, if it was an inversion sprain and we want to strengthen the everters, then the band around the ankle sidestepping is a pretty good one.
Awesome. And I think that this might be a good place to just mention for you folks that are engaging and working through the training plan. There is some sort of ancillary info that we put with that plan, and Andrew is really honing in on kind of what we're trying to get at with that is that don't be a slave to your plan. Don't treat it as the end all be all, and vary it. It does take a little bit of work on your part, and I get that it's reassuring. I've been there to just have a layout set up for you that you follow diligently every single day. And we do have recommendations for, kind of a series of strength exercises. And what you won't see, because we're reaching to such a broad range of folks, is a vast catalog of exercises. These are just kind of targeted to talk about or to work toward mitigating some of those movement patterns that tend to be chronically problematic in ultra runners, trail runners, that sort of thing. But with all that said, certainly feel free to mix it up. This is kind of meant to be an inspirational starting point, a good guideline. But variability is definitely the spice of life where durability is concerned.
I'm going to throw another question at you, Kate, that's kind of related back into the training program. It has to do with kind of the way you've kind of emphasized kind of a different focus for some of the different days. This is from Francesca in Bellingham. Hi, Franny. So it asks you to explain the difference between the descent versus the climbing focus And then with that, her question is your thoughts on splitting long workouts. Like what if I were to do half in the morning and half in the evening? How does that play out? So kind of maybe describe that climbing, descending focus, and then your thoughts on that.
Yeah, I'm actually going to take her last question first about splitting workouts. If that is what is workable in your life, again, this is a really good situation as to, you know, are you going to be stressed out for the entire day because you simply don't have time to get that long run in? You know, that's stress. That's additive stress over a period of time. So if you need to split your workout, go for it. You know, ultimately, though, you are going to need to, if your goal is, you know, something like the Wonderland Trail, or you've got a really super long objective, like 100 or 100+ miler out there, you'll want to have a significant amount of training where it's just time on your feet. So if you're somebody that spends your day standing, and if you've got a really active job, don't discount that, because that is additive stress as well. You probably don't have your watch running, counting that as training, but, you know, kind of retool your mind around that and think about how all the factors in your life, you know, are you chasing your kids up and down the stairs every night? That, you know, count it, it's training, right? And then as far as the questions that she had about climbing and descending focus, this is a great situation where you might have a friend video you if you really want to get into it. And there's a lot, I mean, it's great to go and talk to a professional like Andrew if you've got pain developing somewhere in the body, but you may learn a lot about what you look like running from just taking a casual video of yourself. And you don't necessarily need to know all the ins and outs of, you know, locomotion and human biomechanics, but, you know, look, do you have a knee that's diving toward the midline? Is it doing that every single time you take a step up? So with the climbing focus, what we're looking for, you know, is your torso or your upper thoracic area, is it kind of caving and compressing down toward the hips? Are you shortening that distance so that you're limiting your respiration? You're not going to be ramrod straight. You're not going to be entirely perpendicular to the hill that you're going up, but, you know, you'll have a forward lean. But what we don't want to see is that kind of collapsed thoracic spine, because that's something that can be indicative of, you know, it might be weak spinal extensors, it might be hip locomotion issue. And you also want to be, you know, looking for, am I getting enough hip extension? A lot of people, you'll shorten your stride as you go uphill, as you start to climb. And that's just like being on a bike. We talked about this a little bit last time. You'll want to drop it into a lower gear to ascend more efficiently. But, you know, thinking about how am I getting up this hill? Am I doing it the most efficient way that I can do it? Is my chest kind of caving downward? Am I getting that real sort of C shape in my spine? That's can be indicative of a number of things. And also, you know, is my stride shortening to accommodate the terrain I'm on? But the flip side of that is that you don't want to entirely limit your hip extension, meaning your hip kind of floating out behind you. You do want to have a little bit of that toe off. And that's where that power will come from when you're ascending. Descending in particular is a place where a lot of people may start to experience that anterior knee pain that Andrew talked about. And, you know, again, it's hard to pinpoint it exactly without, you know, having a biomechanical analysis by a sports doc or a physio. But what you know, another thing that you want to be watching for is that contralateral hip or the opposite hip that you're not putting weight on. Is that dropping every single time? You know, are you getting knee pain because, again, your knee's diving toward the midline? Or is your hip, are you getting what I like to call Marilyn Monroe hips? Are your hips really kind of swaying? Because that could be indicative of some lack of isometric strength in the glutes as well. So, you know, basically we're looking for good form. You want to adapt to the terrain. What's your thorax doing? What's your upper thoracic spine doing? Are you breathing and getting enough respiration and enough air into those lungs? And if you've got poles, use them. And that's part of where the functional strengthening comes in. Runners love to run, but they don't love to, stretch and weight train and do all those things. So, is your pole use efficient, or are they just kind of floating in space and not really doing a whole lot for you functionally? So, plant that pole and use it. Yeah. I hope that answers. That was a bit long-winded, but there's a lot to say on that subject.
Cool. There's a lot we could say about a lot of things. We're not going to cover everything you need to know in an hour.
Yeah, scratching the surface.
So I am sensitive to kind of everyone's time. We kind of build these things for an hour. I do want to spend a little bit of time just kind of talking about Yosemite for anyone that has questions about that. Trent, are there any other kind of last minute repetitive questions you see that we need to kind of maybe hit in quick order?
We've got two in here. Maybe I'll just read. Let's see. One is, both of these might have sort of an abbreviated answer possible. One is Aaron Shaw says, I'm increasing my mileage slowly, but I also spend a lot of time driving each week, 7-hour drive 2 times each way, and her accelerator side of her hip can cramp up or be uncomfortable. So she's wondering if there's something she can do about the kind of one-sided pain that seems to be associated with that drive. The other one that sort of has a similar causation theory is Cate Airoldi in Vermont, who spends a decent amount of time running on roads with some camber to them, and has noticed some knee pain, suspicious maybe that's kind of a cause to it. So if there's any recommendations that you guys have for preventing injury in that kind of situation. I've had a similar kind of thing pop up with running on the beach with that camber. That's wrecked my IT. So I'll take anything you got on that.
Should I go? I'll go real quick. I think running on the crown of the road is the quick fix. If you can, find quiet roads. If you're going to demand road running or that's all you have available, go early in the morning and run right on the center line. That's really the only way you're going to, if that leg is washing out and not hitting the ground often enough, you're going to have elongation and, again, strain and force, and it's going to be abnormal until you fix the surface type. And so running on the crown of the road is the quick fix there. As far as the driving, feel free to shoot me an email. I've got a post-travel hip 5-movement series sequence that I give my athletes, and it's basically like your iliacus and your hip flexors and likely your quad are just getting locked up, and your hip extension is disappearing because you're in a prolonged position. And so a little bit of at truck stops, doing some scraping the mud off the bottom of the shoe type movement is going to help open up that the muscles that ultimately go through the hip and attach to your spine. It's probably really simple, and it just needs low load, long duration stretch. Research on that is 3 minutes is what's required to show effective elongation of tissue. But if you shoot me an email, I'm happy to send you what I think works.
It's fast at Gmail, right?
Yeah.
All right, that's in the chat.
Awesome. Okay, well, I want to switch gears a little bit and cover Yosemite, which, Andrew and Kate, you guys are welcome to stick around for that or not. It's kind of your call. Are you going to stick around? If not, I would do a more formal goodbye.
No, I'm going to stick around, but I don't want to look at myself. Can I get rid of my screen?
Oh, I don't know. I will need it. Can you make me the host again? Can you?
I'd love to make you the host. Let me see.
Then I can do my screen share.
Settings. How did you do it?
If you click on your name in that right-hand corner, or click on my name and there's more, I think you can make me the host.
Upper right-hand corner.
There's kind of I've got this view of panelists.
Oh, okay. Yep.
And then I think if you click on my icon,
click on, right-click on you.
Yeah. That should make me the host. while he's doing that, I'll just do kind of a little bit of intro to kind of our Yosemite trip. So Yosemite sort of is a place in the world that really does not need a whole lot of introduction. It was, you know, basically the birthplace of American wilderness conservation, you know, from the likes of John Muir, Teddy Roosevelt, from the golden era of, and really the birth era of that conservation movement. It's been a rock climbing mecca, and it's phenomenally gorgeous. I mean, all of our trips are wonderful, and the one word that kind of really strikes me every time we go to Yosemite is just sort of the immediacy of the grandeur. To see giant granite domes sliced in half by glaciers and huge expanses of granite and deep waterfalls and canyons is just, it's awe-inspiring. And in the way that we travel through that terrain as runners, we get to see so much of it over 4 days. The route that we have laid out is a 4-day, 100-mile route. I'll go ahead and share my screen. It'll just basically do a, oh man, the host is disabled screen share. Was I made the host yet? Looks like Andrew's still the host, so.
I'm still trying to, I would love for you to be the host. I haven't figured out how yet.
So I'll keep talking without the map, but it's a 4-day trip where each day we're covering 25 miles. There's been a little bit of typically we have a campground inside of National Park, inside of it, basically along the Tioga Road. I could show people on the map here in a moment. This year, Yosemite, due to COVID, is not opening quite a few of their campgrounds. So this year, our itinerary will look a little bit different in the sense that our base camp will be located just on the east side of the park, just outside of the park entrance. And then we'll be doing vehicle shuttles to get in and out to our trailheads each day, rather than having a campground in the park. And that's just due to the fact that those campgrounds where we're typically at Porcupine Flat is not opening this summer. Day one of the trip is a 25-mile run along the north rim of Yosemite Valley. So we come in, have a dinner, meet and coordinate and connect with everybody. We run along the top of El Cap. We run across the top of Yosemite Falls to the top of North Dome, and we're getting some pretty spectacular valley views of Yosemite Valley proper. And then it'll be a finish and a shuttle outside the park to our campground, dinner, and then a shuttle back in the next morning. Day two, we go through around Tuolumne Peak through the 10 Lakes Basin, which is a real taste of some pretty quality Yosemite, like Sierra High Country, backcountry, some big deep river valleys, beautiful lakes and canyons. Day three of the trip starts at and goes over Cathedral Pass, which takes you up to a really gorgeous, beautiful alpine lake. And we travel a little bit south on the John Muir Trail, and then we climb to the top of Clouds Rest, which the great thing about Clouds Rest is it's an incredible view that looks due west right down the middle of Yosemite Valley. But you don't have to have a hiking permit like you do to get to the top of Half Dome. So it's directly to the north of Half Dome. So a really similar visual experience with a lot less traffic and a lot less congestion. So we climb to the top of Clouds Rest and then continue along. That's a little bit of an out and back, and then we head north, finish at Tenaya Lake, which is a great place for a post-run swim, where we'll kind of have snacks, and each day there'll be snacks and beverages at the trailhead finish, and then as people congregate, we'll be running shuttle vehicles back into our base camp. And then day 4 of the trip looks like a run through Tuolumne Meadows. And then it goes over what's called Vogelsang Pass, which is some of the kind of the deep high Sierra country. All right, and I'm the host, so I'll go ahead and do a quick screen share. Pull that up. So visually, I'll just jump right in on day 4 because that's kind of where we're at. So our campground will be, so the park entrance is right around here. I'll turn off my avalanche later real fast. slope angle. And so the park entrance is right here just after Tioga Pass. So our camp will be down here at this Big Bend campground is right where we'll be camping, because the one we typically use here is unavailable. We're usually down here at like Porcupine Flat, which is kind of in the center of our itinerary. Anyways, so the last run, that last day, we go out of Tuolumne Meadows, come over here over Vogelsang Pass, and then we come out and follow the Merced River, which is the main river that flows through Yosemite Valley. As we come down through Yosemite Valley, they call this the Mist Trail, and we kind of come through a series of cascading waterfalls, and then our 4th day finish is right here in Yosemite Valley proper. It's all in all, it's mile for mile some of the best trails there are in Yosemite National Park. A lot of it intentionally avoids kind of the central main valley. So that's where 90% of Yosemite visitors flock to, is to that main valley corridor. We finish there and give people a chance to kind of finish their run and finish their trip in Yosemite Valley and get that experience. But all of our time is really on high country, backcountry trails. Yeah. Any questions about that for folks that are still sticking around?
I went ahead and dropped the course page in the chat, so you guys can check that out if you want to dig in to the details on there. And then we also recently published a blog by Aspire crew member and contributor Ian Ramsey. He wrote up a sweet piece about kind of the history of the park and how that relates to now. There's a little bit about kind of recent running history in there. So pretty sweet little blog to check out too.
I'd say the biggest thing about our trip to Yosemite is it's traditionally a really hectic place to visit. Campgrounds are hard to get. It can be really congested, and having the Aspire crew basically working out all of those logistics and shuttles allows people to do a lot of these point-to-point runs, not have to worry about any of those transportation camping pieces. Really great, small, intimate community. We can bring 14 runners. So it's a nice sized group where people really are supportive of each other. There's modifications we can make each day. So if someone's feeling like that stress load, like we talked about in the session, was just a little too high and they need to take a lower mileage day, then we can make that happen. So whether it's an out and back or a shorter variation, we've got a few tricks up our sleeves to make it a pretty accessible experience. So if you're feeling like 100 miles might be a little much over 4 days, we can whittle off some miles and people could still have a really great experience. So yeah.
Well, I've been trying to get down and work that trip for the last couple of years, and I will get to run. So come run with us.
It's gonna be fantastic. All right, well, I'm gonna go ahead and just say thank you to all of our participants, everyone that tuned in. Hopefully they've taken some value from the experience. Andrew, thank you so much for your wisdom and your words. I really appreciate the way that you're taking complex, heady topics and making them accessible in ways that we can kind of remember and reflect on. So I think that you did a great job breaking it down into simple equations that can help me really think about that stress, load, recovery, and use that to influence my training. So, and thank you for making your personal contact, available for folks that have additional questions. Andrew and I met on the Wonderland Trail at Mowich Lake, and we've kind of been just kind of chatting it up in a few different formats ever since then. So I'm glad that you're able to come on and make this happen. So.
Oh man, I'm such a fan of what you guys are doing. I really am. It was a privilege to be on, and thank you for having me.
Yeah, great. And Kate, thank you so much for the training plan and your wisdom and participation. as always, you bring so much, and it's great to have you here. So
happy to do it, and really nice to have Andrew along too for his super expertise and just a really good example of the kind of provider that all you folks out there want to be looking for if you do encounter a problem. So it's good to have somebody in the know. Yeah.
Thank you. You're so great. It's nice to virtually meet you.
So we've got 2 more of these webinars that'll happen. We've got one at the end of May, or what month is it next? One at the end of April, and then one at the end of May. Actually, 3 more. We got one at the end of June too. So we'll have another guest on, and we'll have Kate here for the training program. Thanks everyone for tuning in. We'll have this thing up and available for recording for later. I'm going to go ahead and sign off. Have a great Sunday evening, everyone. And
Cheers.
Cheers.
cheers. All right. Stop. End.